New York City, September 2015, and a summit at the United Nations which could change the lives of millions of people around the world. For those living in poverty, who struggle to access good health care, and for whom life is a daily struggle, the Sustainable Development Goals, which have replaced the Millennium Development Goals, offer hope. These set of aims are ones which the University of Edinburgh is determined to help develop and implement, which is why the university's Global Health Academy brought together an array of senior experts in New York City to discuss the challenges.
Sustainable Development Goals will have the potential to change the world. These goals, these 17 goals, which are looking at a shift in the way that global health is activated, the way that business is activated, the way that those who are working in climate change respond to the challenges. These goals can really make a huge difference, and Edinburgh can and should and will contribute by bringing in its skills, its support, its ability to be creative around innovation, and its ability to nurture students to become the people who actually become the change makers for the future.
The meeting heard predictions of many changes in how world health care is viewed and delivered, with less emphasis on north to south delivery in favour of locally conceived and provided solutions.
The other major change is that we're going to see a lot more emphasis on governance of health systems, which implies a look at the roles of the private sector, of civil society, as well as the state, in all supporting a healthy environment for people to make informed choices. It's not just we'll pay for commodities or staff or have siloed disease-specific investments. It's going to be the environment, the roles of different institutions, a patient-centered approach, which is actually quite radically different from the way that we've been working over the last 15 years.
That patient-focused approach is certainly one which many at the meeting would like to see more of. The realisation that health provision needs to fit local customs and social norms.
A 15-year-old who have had unsafe sex the last night won't go there because she doesn't want neighbors to see her. She doesn't want, someone to talk to her guardian or her parents about that. But having, a specific space, where a holistic package can be providing in terms of access to health information, in terms of access to actual services, focus on the adolescent, youth specific age is what should be available.
Employing the latest technology from a wide array of academic fields is another essential to improving healthcare, according to those who've studied the problem.
And if you think about, pandemics and epidemics, the ability to model those properly mathematically and with data collection is going to help us understand how that spreads. And of course, one of the things that we've noticed recently with social media is that is a very good indicator of people's behavior, how things spread. So sentiment analysis, as it's called, looking at social media feeds can also help us here.
One theme was dominant at this meeting: the need to work together, pooling resources and bringing together the best ideas.
You can't do everything. So what are our strengths at Weill Cornell? What are your strengths at the University of Edinburgh? And where can we work together, band together, and focus on something that, one, is going to be meaningful to make a difference, two, that the host institution actually feels is very important. We get on a plane and we leave, but it's got to be their program. So we take a look at where there's the most need, what we can contribute individually and collectively, and then work with an excellent partner at the host institution and hopefully make it work for the people that live there.